I do work out of an office at BCH, Boulder Women's Care. We have a number of great OB/GYN physicians. We do obstetric care and deliver babies, as well as kind of offer a full range of evaluation for GYN problems, including these. We have gone through a time of seeing absolutely no patients in the office as COVID landed upon us, and we're extremely careful for a long time. We, in the past few weeks, have started to see more patients in the office in a very safe and careful way. So I do think that it's true that you should feel safe to come into the office for these problems. I think in a lot of ways the office feels a lot safer to me than the supermarket sometimes, and we're meticulous about safety around there. So I just want to empower you guys that if this information sounds relevant and like something that you really want to get dealt with, please reach out and come in for a visit if that sounds comfortable to you. I also would be happy to kind of start this process by answering questions over the phone, maybe having some kind of virtual visit just to get things started, because it's really, as a lot of you know, these are problems that are really painful to sit around with, not knowing when you can get help. So